Hey family, this is your girl Shannon Jackson, your resident host from Living Your Life Without Limits. Today's topic is talking about public health and serving the community. And I brought a special guest with me today, none other than MARIA.KEMP, Project Manager for Cut COVID. Stay tuned, you don't want to miss it.
Wake up everybody, let's elevate your mind. Live your life without limits, no more wasting time. Don't forget to stay focused while continuing to stay on the grind. Keep your vision real tight, and your future be bright until the finish line.
Once again, family, thank you for joining me today with this important subject titled Public Health and Serving the Community. And we're going to be focusing in on vaccinations. And I want to make a full disclaimer that both Maria and myself have been fully vaccinated, as we're sitting in this area without masks talking about the importance of vaccination. And once again, Maria, thank you for taking time to join us on Living Your Life Without Limits. It's truly an honor.
My pleasure. Thank you for having me.
Likewise. And I want to start off, first of all, I'm very impressed with your background and how you went into a very important area about public health. But actually, what made you choose that as a passion? You don't often find many females, let alone minority females, choosing a field of public health. So talk to us about that.
Sure. Well, thank you again for having me and for asking that question. Public health, as you all may see and know now, that is such an important field to be in right now. And being from Florida, I really did not aspire to pursue health sciences initially when I arrived in Los Angeles. However, a turn of events, like most of us in our lives, personal experiences led me to want to understand more. And for me personally, I couldn't stop thinking about this experience that I had when I was a young child, and I went to a church meeting, I believe, and one night we were supposed to be congregating, but we were actually expressing our condolences and crying, and we were grieving the death of a child. They explained to me later that this child had passed away in the hospital because of a negligence. And that stuck with me for a really long time and probably caused me trauma, but I didn't process that until later on. That was one experience. Another was, of course, being Black, being of African American, ethnic background here in America. We very often see deaths within our own families of loved ones, of very close relatives and immediate family members, often unexplained. And the death of my grandfather, when he passed away in 2001 from pancreatic cancer, it was very sudden, and we did not have a lot of answers. That scared me and shook me to the core. Again, carried on with my life, just kind of went about things, as usual, and here I am, just a little over 15 years later, having moved to Los Angeles. Upon arriving here, my dad was diagnosed with stage 4 cancer just weeks after I had come to live my life, start a new, beginnings, jump into a great career that had nothing to do with public health. But his story and the way the healthcare system proceeded to handle him really prompted me to want to understand more. Thus, a year later, I started doing the research, conducted my own homework, wanted to understand what field is this? Do I need to be a doctor to understand why the healthcare system is fractured? Do I need to pursue medicine to understand why my dad's diagnosis came so late? Where exactly do I go to get these answers, not just for myself, but for my family? And I happened upon public health. I was fortunate enough to discover Charles Drew University and here in Compton, California, that had the perfect program for myself, for working adults, evening classes, 2-year program, and the rest is history.
Excellent. And it is. I can vouch for Charles Drew University. I haven't worked directly there, but I know many people that came out of there as practitioners of different levels, having worked alongside of them, and they produce quality students that turn into be excellent professionals. So thank you for that background in there. And you touched on something before I go into your next question. One of the key issues with public health that I think many people don't realize in the study of it and in working in public health. I myself have a public health nurse certification as well. So early on, I did some stuff with TB and going into the community. But a part of the public health role is educating.
Absolutely.
And bringing an awareness to people, and especially people that have not a lot of resources, right? So mostly minorities or urban communities, providing those resources and education and also medicine, and we're going to talk about your role with that as well, to those communities so that they can have support in the health and wellness arena. Because what we do know in research in the past and statistics, it's been a lot of forgottenness that has come to the minority community, especially the African Americans. So there's always been that love and hate as it relates to medicine, with the Tuskegee Airmen's issue that happened, and the syphilis and various things that happen today. So that segues me into what I was very impressed, and congratulations on your award, in reading your bio and how you had won an award for your research in the studies of diabetes for African Americans and Latino communities, right? Yes. So what did your studies, your research reveal?
Wow. Well, to answer both sides of that question, the public health and the diabetes research, I pursued diabetes because of the mentor that I was assigned with. However, he had this unique ability to use technology in order to identify cases in South LA. Research alone is not fun, but the way we were going to go about conducting ours seemed highly interesting and very effective. But to be more specific, diabetes mellitus is rampant in Black and brown communities.
Absolutely.
That is an epidemic that we don't talk about.
Absolutely.
Right?
Absolutely.
It doesn't, take a virus to hit for us to take health seriously. That is the perspective of a public health scientist or a practitioner like you and me. We don't have to wait for something to happen for us to take action. Public health, right, is about prevention.
Exactly.
So that is the focus. But to tie both of those, we wanted to target and highlight not just diabetes prevalence in South LA alone, but we wanted to shed light on the environmental factors that contribute to these things. Because if you look at it from a bigger picture, on a national scale, diabetes and other chronic illnesses are concentrated in impoverished communities. So when you kind of take a step back, we wanted to then analyze, what environmental factors are contributing directly to the health status of these households. So in our research, we used a multitude of databases, some from LA County, some that were national, in order to kind of hone in on census tract data. So we only focused on zip code, clusters of zip codes, if you will, that we would consider a neighborhood. In South LA, the Hispanic population is over 70%. However, African Americans are not only diagnosed, but die at a higher rate. What we found is that if you are a half a mile or more from a grocery store, much like the residents in South LA are, your likelihood of having diabetes, serious diabetes, and even being prone to death was higher than someone who lived closer to one.
Because of access or lack of access.
A lack of access.
Lack of access.
And in our case, we just simply use the term distance. Right? So that was with grocery stores. What we also found was that in these same households, if you then factored in the fact that they did not have a vehicle to then drive to the grocery store, rates increased. And then when you factored in the neighborhood and the surroundings, the crime rates, things of that nature, rates continue to increase. And let's not talk about median household income. These households are impoverished.
Would you say that the most surprising, and you can answer in your own words, what did you find the most surprising? Was it more of the environmental connections that was going on versus we already kind of knew about the medium income type piece that was there, that they just don't have the resources to pay for gym memberships or the money to buy healthier food and things like that? But how did you, were you shocked at the environmental? Because in your research, I'm actually shocked at how you guys broke this down to show that tie-in with the environmental.
There's a myriad of other factors that come into play, especially with these vulnerable populations that we're targeting, right? But this was a secondary research. You know, the way we conducted it was with secondary sources. So I didn't interview anyone. We didn't speak to any populations.
You looked at
or
the
anything.
data that was already there.
Yeah, we looked at pre-existing data. And I would say the most shocking thing was that people wanted these resources. You know, if we were able to analyze diagnosis prevalence, that means the data's there. That means these people went to a doctor or they went to a hospital and they were able to be documented as being diabetic, right? However, what we found was that beyond being diagnosed, where was the treatment? This research was multi-layered, but just in what we did, that was a top layer. Just analyzing the environmental factors, those few. We only looked at household income, distance to grocery store. Forgive me, we also analyzed distance to the nearest park. So we did look at their access to green space, which does directly contribute to your health.
Physical exercise,
physical activity. And we already knew just with empirical knowledge of the, not only history, but the present climate of these communities that people are not walking places because you are then at risk. You know, given
that's where the crime ties in and so forth like that.
Exactly.
Excellent. And it segues me into the next topic, which is COVID. So one of the things, just for you and maybe others that did not know, when COVID first hit, I actually went to New York at ground zero and worked with the COVID patients and answered the governor's call. I was gone for 2 months. So it was almost like a mass unit. I thought I'd never seen anything like that than I saw before. But what it did when COVID loomed up, it highlighted what was already there, like a sore that just opened up from the scab, that pre-existing conditions played a critical role in the life or death or demise or mortality of people that were diagnosed with COVID. So it is very, very important, as you mentioned, the role of public health, as well as educators and coaches and mentors and individual accountability, that people try to manage their lives in a preventative way. Now comes the conversation about your role working with Cut COVID and Trap Medicine, which is I love the title, by the way, Trap Medicine. And talk to us about that and how you, as a project manager, organizing and facilitating the vaccination program through Trap Medicine.
Definitely. Well, thank you for sharing that experience. I had no idea that you were, played a part firsthand in what took place in New York, which was quite devastating. But thank you for asking. So Trap Medicine is my friend's organization. If you all are interested and curious, please learn more at his website, www.trapmedicine.com. And it's a nonprofit focused, of course, on, highlighting and leveraging cultural capital to engage with our communities effectively. But of course, learn more there. So Cut COVID is the name that he and I both titled this fellowship that we manage.
Wonderful.
And Cut is kind of a, caveat, if you will, for not only wanting to decrease cases of COVID in these communities, but because we partner with barbershops.
Yes.
So
I love that angle. That's why, I definitely wanted you to bring that out. Excellent.
Thank you. Well, I'm very humbled to speak on it. I'm definitely fortunate to be doing the work. I give all credit to, my colleague whose nonprofit it is, but The goal of the Cut COVID project that we're doing well into the fall is, of course, to increase access to communities that are vulnerable and underserved, medically underserved, and that lack access and knowledge. And the reason we do this with entities like barbershops and hair salons is because these are spaces in which we feel most comfortable discussing topics like health. Also,
and not to interrupt you, it's the perfect place because we're gonna go because we want to look good. We're gonna go to the barbershop and we're gonna get that hair done.
Okay.
Whether we buy it, sew it, or sell it. It's
No,
going to be
seriously.
done. So it's the ideal place to have the conversation because sometimes in the barbershop or your hairdresser, that's your confidence. So
Yep.
kudos.
That's
to
your
you guys
therapy.
For that. Exactly.
That's your therapy.
Kudos. Yeah.
Thank you so much for that.
Yes.
But yeah, in a nutshell, we are aiming to target these communities. We're in the community. We're on the intersection of 54th and Western in South LA, right just north of the Slauson Super Mall. And we're there every Saturday to provide testing to unhoused population, but also residents of the community. What we have done is extended those services by offering a blood pressure screening. We also do a wellness survey. We do a mental health survey. And in that time, we're able to gauge and get people's inquiries about resources that they need. Because this is something that's so crucial in public health, right? Is that it's one thing for you to go into a space to target the problem. But what you also have to always be aware of is what more do they need? Because oftentimes they themselves can't even articulate it.
Absolutely.
So it's up to us to not only take those steps, but in a perfect setting, right, with public health, is that you go into a community and you establish the trust, right? We've been very successful in doing that. So we not only have established trust, but we now have a presence there. There are people in residence, business owners that come and test every Saturday because they trust us. They have access, some are covered with insurance, others are not. But even those that have access to medical care still come to us because they trust. So we not only do the testing, we've now extended in doing vaccinations by partnering with larger orgs. But the crux of what we're doing is to decrease prevalence in these areas with populations that otherwise would not have access to these things. And we have to do it in a creative and culturally appropriate way so that they trust us to return the next week, in the next week, in the next week.
Are you seeing success in vaccinations through the minority communities? Because I still know there's a lot of people, even in my own family, I champion being vaccinated and try to dispel, false information that's been generated out there for one thing or another.
Sure.
But are you guys finding that people are actually coming on board with, there's a lot of hesitancy for many reasons.
Lots.
Many reasons.
Yeah.
Some may be valid, some may not, but it doesn't matter. It's a hesitancy. But are you finding success in the vaccination realm? Are you finding people coming in and not just testing, but actually saying, okay, I'm going to get vaccinated?
Right. If I had to say, I would say yes, success, because
Good.
in another setting, they might base success on numbers, but we're not going to do that. The fact that residents have registered beforehand and have walked up to get the vaccine, yes, we've been successful in that.
Excellent.
We had one incident, well, not an incident, but we had one experience where a resident who had tested had walked up and was like, yeah, I'm kind of here just to see what you all are doing, but I in no way, shape, or form want to get vaccinated. I'm just hanging out. I see Kaiser here, I see things going on, but I don't think that's for me. Long story short, over maybe a couple of hours or so after talking with nurses, us allowing him to partake in our therapy pet situation in the back and really just listening to him, which oftentimes people just want to be heard. They want to be heard. Maybe they just got out of jail. Maybe they just lost a loved one. Maybe they're experiencing mental illness or mental instability because of, their finances or work, but they just want to be heard. I would say for us, that has been the primary key in us being successful in delivering vaccinations. Yes, every weekend I'm faced with residents that are driving by honking horns saying, no, get that out of here. When we do outreach and we're walking in the neighborhoods, people come out of their homes to say, not here, not today, I don't want it, get it away, da-da-da. But it's those times, right? You know, in philanthropy and community service, I'm sure you can relate.
Yeah.
It's those moments where even in the midst of constant rejection, there's one resident that's like, thank you. Thank you for what you're doing. I'm gonna tell all the parents at my school and I'm gonna educate all the students about what you all are doing, and then they give me a business card.
Excellent. And the thing that I take away from that, because you're absolutely right, there's always gonna be a mixed bag. For a variety of reasons. The education is what you're doing and informing them. And what I often say to people, my greatest role as a coach, as a nurse educator, as a person working in the healthcare profession is to give you information so you can make an informed decision. And ultimately, the decision is yours. But understand the risks, the benefits, and the outcome.
Yeah.
And if I have done that, whether you come this way or not that way, then I have been effective in informing you of what the potential outcome can be. So,
Yes.
This is wonderful work that you are doing with Cut COVID, but trap medicine and your role within trap medicine is beyond. And obviously this is the focus right now because COVID's the focus for everyone, right? From all walks of healthcare profession. But after this ends, what's next for trap medicine? And what's next for Maria's project management role within trap medicine?
Well, I'd be excited to know myself, but that is something that we constantly think about even now is how do we pivot? Okay. There has been a drastic decrease in testing, obviously,
because they're everywhere, big sites. Yes.
Yeah, they're closing sites and testing, which is not only indicative of very progressive public health efforts in California. We have some of the highest in the state rates of vaccinations, but it's also indicative of our interventions being effective on a smaller scale.
Yes.
Because even with all the funding and accessibility handed down on a state level, it's still the communities that we work with that are being left behind. Right? So with that being said, we have now transitioned from, we still offer testing, but it's definitely, you know, a lot more seldom than it is with vaccines. June is Men's Health Month. Yeah. Colorectal cancer affects 1 in 7 men.
Yes.
It's very common and it's not talked about much, but we all know Chadwick Boseman. That's what he passed away from.
Absolutely.
So
very young,
and he was diagnosed years prior to his passing.
Yes.
And what's so sad is that the lifestyle and the environment that are contributing factors to exasperating an already chronic and debilitating illness. So with that being said, we're already transitioning and putting a lot of focus on, for example, Men's Health Month in the month of June, and what that means for not only you being vaccinated and protecting yourself in the midst of this pandemic, but also checking in with yourself and understanding where your health is from head to toe. You know, getting a prostate checkup, understanding what your colon health is, understanding what your dietary and lifestyle are doing to you right now and how that might contribute to the vaccines and the possible side effects, right? So that's something we're doing now, but of course, partnering and working with Drew, there's never, you know, a lack of work.
Exactly. And Charles Drew University is
Charles Drew University.
For those that may not know the nickname Drew.
Yes, Drew. Sorry, yes, CDU. Charles Drew, the only HBCU on the West Coast and the entire West Territory.
Right in South Central LA, which I love about that, the heart of everything that's happening.
In the heart of everything.
So as we're getting ready to wrap up with this part of the interview, if it was one thing that you wanted to leave with our viewer and listening audience, because we also listen to people that listen to us as well as watch us, what would you want to leave with them as it relates to public health and serving the community? What would that message be about public health? What would you want to say to someone that's just watching right here?
Yeah, public health is what you said earlier precisely. It is the individual accountability of your health. Why it starts with public is because it's something that is free and accessible for us all to do. You don't need permission to take accountability for your health, whether that's in your home, outside of the home, in your workplace, at your job. It's so important for us to understand and respect science on this level. We're very objective, and that's often my approach when I have to educate people on the vaccine, especially those who are hesitant, is that, look, we follow laws. I don't run red lights. I stop at stop signs, and I don't argue about it.
Right.
So when the vaccine came, I, of course, had my hesitations, my own, but I did my homework and I thought, well, I understand prevention and I understand the overall mission of public health. So objectively, I'm gonna decide what I need to do about my health so that I can then inform others to do the same.
Excellent.
But it's so important that everyone take accountability for their household health, for themselves, their loved ones, and understand what it is about you as an individual and your environment that is contributing either to your health or your lack thereof.
Well said. So once again, I want to thank you for being on the show with us today, Maria. And one of the things that Living Your Life Without Limits does, we are also part of we have a street love, that's our community outreach. And although this is not a street love episode, I'm very committed to helping other healthcare causes. So Living Your Life Without Limits will be donating 10 blood pressure machines to Trap Medicine to help with continuing your support with the community on blood pressure management and maintenance and being preventative in that light. And we're honored to do that. So we will be getting those over to you this week. I want to leave with a final thought on something that you said before I sign off. It is so important, family, that you take accountability and advantage of support and resources that are there for you. It is no longer where things aren't accessible, whether you have money or not. There is resources that are out there to help you with whatever is going on with you medically. You just have to tap into it. And one of the things before we leave, what is, if people want to reach you?
Thank you for that. The nonprofit through which I have the honor of working is www.trapmedicine.com. It can also be found on Instagram, just at Trap Medicine. My personal page is Malia Experiment. So we're on Instagram. My email is maria.kemp@att.net. And you can contact me there as well. And you can find us in the community again in front of Good Fred Barbershop every Saturday from 9 a.m. to 3 on the intersection of 54th and Western in the heart of South Los Angeles.
Excellent. Once again, I want to thank Maria, my special guest, for being with us today in this important topic of public health and serving the community. Living Your Life Without Limits motto is we come to motivate, elevate, inspire you to live your life without limits. And it also includes education. And as I often end every show, I'm not going to do anything different today. Remember, family, to love yourself. Take care of yourself, because guess what? You are absolutely worth it.